Well, welcome to today's video. It is Sunday the 5th of April. Now, I've got a bit of a roundup of news today, but before we do that, in fact I think I'll do this as a separate video, I thought there was some merit in running through the UK government guidelines. Now, yesterday I read out the letter sent to every household in the UK by the Prime Minister, and it's accompanied by this leaflet as well. So if you're in the UK, look through yours at the same time. We'll try and explain some of the background of this as we go through. And wherever you are, the principles in here are going to be useful, but of course you have to follow the guidelines from your own governments. So we're being told to stay at home. The most single important action you can take is to stay at home, to protect the NHS and save lives. This is all to do with that curve. We need to flatten that curve out. So without these interventions, the number of cases would keep going up, and the 12 or 14% of serious and 5% of critical cases would keep going up in relation to the increase in number of new cases. So it's very important that we keep the number of new cases down, so we lower the total number of people that need hospital care all at one time. So we're only allowed out for shopping and basic necessities, one form of exercise a day, any medical need, and travelling for work purposes, but only where you can't work from home. And people, by and large, in the UK are obeying these. So for the most part, I think we're actually doing reasonably well in the UK. And the other thing I've noticed that's particularly interesting is it's become socially required. So yes, the police are enforcing this in areas. Yes, parks have been closed because too many people went sunbathing instead of going for their exercise. But just moving around to the extent I have, you get the strong impression that it is socially unacceptable to break these rules. You would be socially looked down on. It would be a bit like smoking indoors or being drunk in public. So that's encouraging. It's kind of been taken as a norm, and wherever we live, I think we need to foster that. So you can freeze frame and read this if you're not in the UK, but so children, for example, who've got parents in different homes can basically treat two homes as one home. Not ideal, but that's what the government's currently saying. So that's interesting, staying at home, and people by and large are. Now, symptoms of the condition. We've looked at the symptoms many times. The main ones that the government wants us to take note of are a high temperature and a new continuous cough, a high temperature or a new continuous cough. So anyone who has these symptoms should stay at home for at least 7 days. Now, what's the thinking here? Well, the thinking here is that, as we looked at yesterday, people are infectious. That means they can transmit the disease to other people for about 3 days before they become symptomatic. And they're most symptomatic when they first have the symptoms, but then they will be they can still shed the virus for a few days after that. That is the idea. So the most infectious time is about 3 days before symptoms are developed and about 3 days after symptoms develop, or 4 or 5 days after symptoms develop, to be a bit safer. So what we're saying is self-isolate at home and then go out on the 8th day after that. And the idea is that by the 8th day, you will have made antibodies to the virus which is invading the body. And those antibodies will have greatly reduced the viral numbers, if not eliminated the virus from the body. So that means because your antibodies have killed the virus, a person who was infected and symptomatic 7 days ago should no longer be shedding the virus. That's kind of the thinking behind that. And that does seem to be consistent with the science that we do know about, although of course the science on this virus is unfolding all the time. So once the 7 days have passed, provided symptoms have ended, then there's no longer any need to isolate. Now, our own Prime Minister served his 7 days in isolation, having been diagnosed with the condition. But at the end of that 7 days, he still had a fever. So he still had symptoms. So he still carried on his self-isolation, and he is still doing at the moment, I believe. So if symptoms persist, the isolation needs to last for longer. But for most people who have a mild illness, the 80% who have a mild illness, on the 8th day, they can go back out and assume that they are not spreading the virus at that point. And this is a reminder not to go physically to hospital unless it's absolutely critically essential. Telephone appointments for GP surgeries. And again, this has got to be a principle that should be applied all over the world, everywhere. Now, advice for those who are 70 and older. Now, this is the concept of shielding, that people who are over the age of 70 and that people with underlying health conditions should self-isolate and should not even go out for work or shopping. They should self-isolate, and supplies should be brought to them by helpful people. Sometimes this is done officially, sometimes this is done through local help networks. So this is the importance of local communities coming together and make sure that no vulnerable people or older people have been missed out, that there's no one sitting at home who's not got their basic supplies. And as well as giving these people basic supplies, whenever you can, give them psychosocial support as well. That could just be a phone call. It could be a wave through the window as you're delivering food supplies. It could be a message. So anything that lets people realise that they still are part of the community in every sense, apart from the fact that physically we can't mix for a period of time. Now, this deals with business arrangements for the UK. Now, these are going to vary depending on where you are, of course, in the world. So I'm not going to spend a lot of time on those. If you wanted to read that, you can freeze frame that and read that. Now, I thought this diagram was particularly useful. I do like diagrams, as you know. So this is sort of a household here. So if person A in the household becomes symptomatic, so person A develops symptoms, then that means that is day one. So day one is the day when the person first develops symptoms. Now, unfortunately, this does mean that they would have already been infectious and could well have passed the disease on for 3 days before. But unfortunately, we didn't know that. That's why the social distancing has to be uniform. We're applying uniform conditions to everyone because I don't know if I'm infected today. I could be, but not develop symptoms for 3 days and yet be potentially shedding the virus, infecting others for 3 days. That's why I must be socially isolated. But when the person develops symptoms, they have to have a 7-day isolation. So they are isolated. And on the 8th day, the isolation can end if the symptoms have resolved. And as we've said, for most people, that should be the case. Most people's symptoms should resolve in that time. Now, having said that, some people still feel poorly into the 2nd week, so they should self-isolate for longer. Now, here we have symptoms develop, and this person, so 2 days in, this person's also developed symptoms, so they need to self-isolate for their own 7-day period. So it could be that this person is able to go out again because we believe they have immunity, but this person is still symptomatic. This person is going to be most infectious during the first days of their illness, so they'll be most infectious during this first time here, during the first days. But to be safe, we're allowing 7 days, and only then, even then, only if they are without symptoms. Now, person C who's in the household, they never develop any symptoms at all. So presumably they've got subclinical infection that really wasn't noticed, because we know some people do get very, very mild disease. But even so, they must quarantine. So the isolated people with the infection isolate. People that could have the infection quarantine. And that person has to quarantine for the full 14 days. And then if they don't get sick after the 14 days, then they don't need to self-quarantine. Actually, my government's saying isolation here, but the correct term is quarantine there. I have to have a word with someone about that. Now, another person in the household could be quarantined for, in this example, 12 days. Then on the 13th day, they develop symptoms. Now, this is quite possible. If people are developing symptoms on day 12, they could have caught the virus on day 1, 2, 3, 4, 5, 6, 7, because there's up to a 14-day incubation period between someone being exposed to the virus and someone developing symptoms. Having said that, for most people, it's around about 6 days incubation period. But if this person develops, in the household develops symptoms, then they have to, because they are now symptomatic, they have to change from quarantine to isolation, and they have to isolate for a further 7 days and only go out on the 8th day if they are without symptoms, if they have become asymptomatic, if the symptoms have gone away. So I think those guidelines are pretty clear, and scientifically I think they make perfect sense actually. So I'm pretty happy with those guidelines. Now, basic advice on spreading the infection, as we have been banging on about for some time on this channel. Hand washing, and we've got videos on hand washing. Cover your mouth and nose with a tissue or your sleeve, not your hand, when you cough or sneeze. So really this means I'm not in the habit of this. You have to just get into the habit of having a tissue with you and cough into the tissue rather than into your elbow if you can. But the elbow sneezing is a last resort really. But better than your hand and better than into fresh air, of course. Then wrap the tissues up with a contaminated surface facing in the bin immediately, and wash your hands afterwards properly. Because when you cough or sneeze, if you're infected, the virus will be on your hands. You can then spread that to other surfaces through your hands, as well as spreading it through the droplets from the sneeze. So very good disposal of contaminated material. And we talked about this in detail as well when we thought about the sick person. So in a sick room, someone who's sneezing and coughing into tissues should put those straight into a plastic bag that can be sealed and disposed of hygienically. Remember, the virus is going to get in through the mucous membrane, so that's the eyes, the nose and the mouth. So don't touch with your hands. Now, it is possible to do this. I have set myself an exercise and managed to not touch my face with my hands, but it is difficult. Again, studies have shown that we do it without thinking up to 20 times an hour. Just shows the importance of meticulous hand hygiene. Clean and disinfect frequently touch surfaces. So if you look on the disinfectant you're using, if it says kills viruses, then that is the right one to use. Go by the manufacturer's recommendations. So clean and disinfect frequently touch surfaces and objects. Mobile phones should be cleaned lots and lots of times every day. Door handles, taps, work surfaces, frequently touched surfaces, pens, objects, tools, keep those all clean. Regular disinfecting. Shop responsibly. There is no shortage of food in the UK. I do hope that's the same where you are. Follow advice in stores. A lot of stores might be exercising social distancing, or normally there's not queuing in my area, but if there is, you have to respect at least 2 meters between individuals in the queue. Only buy what you need for yourself and family and those you're supporting. There is no need for panic buying, and we talked a few days ago about the hundreds of tons of food that were wasted in my area because people bought too much food that they then didn't consume, and the shops are being resupplied. So quite distressing. I hate wasting food. And then the hand washing guidelines, as we've looked at. Now, this is going to vary where you are. Really, most people apart from key workers should be at home. But there's a lot of key workers, of course. So people that work in telecommunications are key workers. Postal workers are still working, as well as all the direct health and social care people. People collecting the rubbish still need to go to work. So there's a lot of people that are actually essential, that really the unsung heroes of our society that we've just taken for granted. And all of a sudden we've realised that no, these people are vital to our health and well-being, just showing how interdependent we all are. We all depend on each other. So working from home wherever possible, of course, that's not always possible. Certain jobs do require people to travel, but think about how you're going to travel and try and do that. Try and do that as responsibly as you can. Always keep an eye on the latest recommendations and follow them. So, what do we conclude from this? Well, throughout this episode, governments and the World Health Organization, and pretty well everyone you care to think of, has reacted when the problem has been stuffed into their face. When it's obvious they have a problem, they've reacted to it. And this has been the problem throughout, reactivity rather than proactivity. If this had been done at a much earlier stage, we wouldn't be where we're at. But we could look back at so many mistakes that have been made by our governments, so many mistakes that have been made, in my view, by the World Health Organization, so many mistakes that were made in the early stages in China with the suppression and covering up of the early parts of the pandemic. But we are where we are at. There's no point looking back. This is not really a time for counterfactual history. We have to go on pragmatically, I believe, from where we are. And I think this is pretty good. I think the government has come to the party late, but I think it's come to the party. And I'm just putting together some news from around the world where governments are still not doing what is needed to do, and people are often not complying with that. But that'll be for the next video. Do come back.